Story 1. I worked with a teenager who was struggling with eating disorders, to the point of being hospitalized for organ damage a few months ago. I went to dinner with her and her mother. Her mom spent the entire dinner counting the individual pieces of rice she was eating to accurately track her calorie intake. I asked her to stop, and she stared at me, asking why she should because she needed to watch her figure. I wonder where the 15-year-old got her eating disorder from. Story 2. I once had a man who was attending family therapy with his 3 children admit that his last child, a girl, was an accident we tried to abort. We only wanted boys. The sad thing is the girl didn't even look bothered. She had clearly heard it all before. They were attending family therapy because the girl was actively suicidal, and they didn't know why. Story 3. I heard concerning information about the treatment of a child who was a sibling of a patient I had never met. I contacted Child Protective Services and reported it that day. The following day, I found out that the child had died. It was traumatic, and 6 years later, I still think about it frequently. Story 4. When I was an intern in my Master of Social Work program, I had a 19-year-old client who told me she was pregnant. She did not know who the father was but had narrowed it down to 3 guys. She was not going to stop using meth and had no intention of attending her obstetrician appointments. However, she planned to keep the baby and let her mother raise it, as she had done with her other children. Story 5. I work as a mental health counselor, licensed as a marriage and family therapist, at a middle school for ages 11 to 14. I never judge the actions of the kids, but some of the parents can be frustrating. I have had students who told me they were suicidal, and then I had to call their parents who seemed annoyed about having to take their child for assessment. In the past, I also had a student whose parent was about to move across the country for a woman they met on the internet just 2 months prior. It's concerning. Story 6. A lovely teenage girl was brought to her first appointment with me by her father. Her mother had, as diplomatically as he could express, recently left the family to live a selfish New Age lifestyle with a healer. She abandoned him with 2 children to raise alone, and he was doing his best for them. Therapy was the daughter's idea. She had been experiencing troubling, intrusive thoughts lately about school shootings, specifically thoughts on how to plan and execute one. These thoughts were upsetting to her, and she did not want to act on them. I can still picture how scared and sad she looked while telling me this. I wanted to offer her comfort, but instead provided praise and encouragement for seeking help and trusting me with this information. She also met most of the diagnostic criteria for the onset of schizoaffective disorder. We included her father in the session, updated him, and explained the most urgent part of the plan. He was going to take her for a full evaluation with a great psychiatrist colleague of mine who understood the situation and was going to arrange it quickly. The daughter seemed relieved, and the father seemed relieved as well. We scheduled a follow-up soon. However, the mother woke up from whatever state she had been in and angrily called my office to express her outrage. How dare I? Am I trying to harm her child with medication? Did I even conduct a blood test and check her vitamin levels? Do I want a negative review or, worse yet, a warrant issued for my arrest? Do I even understand herbal supplements? I need to stop now because my head hurts remembering all of this. Story 7. I had a woman bring in her child for academic issues. The child clearly had fetal alcohol syndrome. I asked her gently if she consumed alcohol while pregnant, which she confirmed. When I told her that this is likely the cause of the academic issues, she said, "I don't feel bad about it. Fetal alcohol syndrome in general gives me a case of confusion." Story 8. I started my first-year practicum at the County Behavioral Health Agency, working with foster children. I shadowed my coworker during a session with a 10-year-old child. On the drive back to the office, she told me that the child was a victim of repeated child sexual abuse and had formed a strong bond with her caregivers, expressing a desire to stay with them. However, her Child Protective Services social worker was actively trying to reunite her with her mother, who was still living with her boyfriend, the individual who had assaulted the child. The therapist continued to advocate for the child to remain with her caregivers, as that was her wish. I just cannot understand how child sexual abuse doesn't result in an immediate decision to prevent reunification if the perpetrator is still living with the victim. Story 9. A patient in a group asked for advice because she felt pressured into having sex that she did not want. A friend had traveled 2 hours to see her and booked a hotel room for them. The group listened, asked questions, and the consensus was along the lines of, "You probably owe it to him." It remains one of the only times I have abandoned experiential questioning and straightforwardly told people, absolutely not. Story 10. Not a therapist, but I was a social worker. I worked with adults with developmental disabilities. A mother of one of my clients asked, "Why do I bother involving her son in activities?" Her son was dropped on the state's doorstep at the age of 3. He was 43 when he became my client. He delighted in and responded quite well to joining activities. It was another soul-crushing moment in the field. So many days of driving home in tears and battling borderline alcoholism to numb the pain led to the end of my nearly 8 years in that profession. Story 11. Maybe not the revelation you're thinking of, but I understand the feeling when I consider all the ways my clients have been able to continue with their lives despite the difficulties they have faced. Story 12. When clients casually mention that a family member they have talked about is still in their lives and abused them when they were young. Story 13. I used to work in an acute child psychiatric ward. I saw many angry preteens and elementary school children, mainly boys aged 8 to 12 years old. More often than not, parents treated their children harshly and were shocked to see that this only made the situation worse. I also worked in an environment where people did not want to acknowledge that their traditional parenting methods could be problematic. One father stated, "I will spank my 11-year-old son when he gets angry. I know that nowadays people don't support that, but I was spanked my whole life and I turned out fine. It took all my restraint not to respond. Sir, you just got out of prison 3 months ago after serving 5 years for a violent felony." Story 14. We can judge, in fact, we have to judge harmful from helpful to be effective at this job. We also have to do no harm and provide the greatest benefit to our clients. With that said, I've worked with child abusers and domestic violence perpetrators. On several occasions, I've worked with murderers and even a few individuals involved in dogfighting. The thing that always struck me was not the sociopaths or how many former police officers I encountered, but how easy a few changes in one's life or brain can lead someone to be just as susceptible to very disturbing impulses. Story 15. The father who told me I had 2.5 sessions to fix his daughter. My teenage client who threatened to assault me while his father remained passive. Another teenage client who got a large tattoo of a band she had never heard of. An extremely abusive mother whose actions made me feel physically sick while reading the reports, had her children taken by Child Protective Services and complained about the food at the foster home not being fresh enough. Story 16. My very first intake session as an intern involved someone sharing that they had been in a relationship with their cousin since childhood. It was quite the introduction to being a therapist. Story 17. I had a client admit that they knowingly infected someone with HIV because they were miserable and dealing with active drug addiction at the time, and they wanted someone else to be as unhappy as they were. Wow, what a response. This topic has always been debated in the healthcare field. To clarify, I cannot call the police just because my client does something illegal. This action is not always considered illegal everywhere. It must actively cause harm, or my client must have the intent or plan to cause harm. Whether you believe knowingly infecting someone fits these criteria is based on personal beliefs and the laws and ethics of your specific state. I cannot ignore my career's code of ethics just because I find a client's actions reprehensible or based on my interpretation of the code. Story 18. I had a preteen client whose guardian kept requesting progress notes to see how they had been doing. It is against clinic policy for clients and parents or guardians to have access to the notes. They are allowed access to everything else, though. The client was very defiant with everyone but was a wonderful child throughout their treatment with me. When I met with both the guardian and parent, who insisted on knowing everything about the child, everything started making sense. Once the parent requested to switch therapists solely because I declined their request for the notes, I realized how unhealthy the family dynamics were. I felt bad for the child because they were opening up more about the family dynamics and how they impacted them. We had a good therapeutic relationship. Story 19. I worked with a former therapist who had a memorable client with serious emotional issues. His hands were scarred and often had fresh scabs on the knuckles. He explained that when he got angry, he would go to his shed and punch the soft concrete or do the same to a dumpster at work. He said he did this to avoid taking his anger out on his girlfriend and children, as his father had done to him. Story 20. I was an intern working with veterans. One of them was a sex offender who was assigned to me, as he had previously been inappropriate with female social workers. He boasted about being wrongfully imprisoned, claiming that the two girls he assaulted were fortunate to have experienced sex with an experienced man rather than a young boy. Story 21. I am sitting in a couples session, my first with them. They openly discuss having 10 children between them from previous relationships and frequently engaging in physical fights with each other. Both describe experiencing such intense rage that they would black out and not remember the fights. Unfortunately, after they were unwilling to pledge that they would no longer use violence, I eventually had to end our therapeutic relationship. Story 22. As an intern, I witnessed a situation where a woman was criticizing a man because his mother is in a group she described as abusive and torturing children. The man had excommunicated himself from his parents and had not interacted with them for years. She believed this was a valid reason to prevent him from parenting his children, claiming he should not be allowed to take them out because of his parents' beliefs. She expressed concern that he might allow his mother to kidnap her kids and sought my support for her views. Additionally, she insulted him, which was unsettling. Throughout the conversation, he maintained, "I don't even talk to my parents, and I love my kids." In the end, she remarked, "I guess I'm just a difficult person, aren't I?" Looking at me for my reaction, I accidentally replied, "Your words, not mine." Story 23. A woman was so desperate for male validation that she allowed her boyfriend to install a camera in her teenage daughter's bathroom. She was a kind woman, and you would never have guessed her background. She had a decent upbringing with positive family relationships, but her father worked a lot to support them and was often absent. Story 24. I saw a teenager who had been sexually abused by their drug-addicted father express a desire to join the military so they could harm others. After hearing their full backstory, I understood their feelings. Story 25. For the most part, I am able to continue having unconditional positive regard for my clients. I don't judge them because they showed up, are talking about their experiences, and want to improve themselves. However, I do find myself judging their families, friends, and partners. Some people can be cruel and unkind, but those individuals would never end up in my office to begin with. I believe that's the difference and the privilege I have as a private practice therapist. I'm sure most of the stories shared here will come from individuals who are working with populations that are mandated to attend therapy for various reasons. Story 26. Mine is much milder than everyone else's, but when someone brings their child to me and can't tell me the child's date of birth, it gets me every time. What do you mean you don't know? Story 27. My moments of realization are not rooted in judgment for my clients. Many of these moments come from compassion for what people have endured. While trauma is not a competition to determine who has suffered the most, I can say that the stories of refugees from war-torn or unsafe countries have profoundly impacted me. However, I'm not sure that the phrase "holy shit" accurately captures that response. These individuals were not immune to serious trauma before the conflict. My country has many flaws, but for many people, it has offered an escape from an early and violent death. Story 28. Nothing shocks me after 30 years in the field, so I never think that way. However, the most depressing thing I come across from time to time is a female patient who submits to an abusive relationship in the kink community. Story 29. We receive unusual consultation requests occasionally, such as individuals who fetishize the profession and non-consensually involve us in their interests through email or phone. Story 30. I am a pediatrician, not a therapist, but as I scroll through this thread, I have heard stories similar to almost every one of these involving children or young adults. This world is truly full of challenges. Story 31. A client left their pet rabbit on their balcony and knowingly let it starve to death without feeling any remorse. Story 32. Not my client, but someone I know. A young person orchestrated her suicide. She was staying with family and arranged for her university to call and offer condolences to her mother for the loss of her daughter. The disturbing part is that the daughter was alive in the house at that time. Her mother hung up the phone, confused, and went upstairs to find her daughter dead by suicide. She planned for her mother to find out this way. It was truly twisted. Story 33. I am a therapist, but also a probation officer. I worked exclusively with sex offenders for a long time. Many stories of incest and bestiality emerged during assessments. I had a client who had a sexual relationship with their twin, which was shocking. Other clients engaged in long-term sexual relationships with their mothers. I don't think there is much hope for someone involved in that kind of dynamic. I do not judge. After 20 years in the field, I have seen various versions of it all. I just feel sad for these individuals and their victims. Story 34. I had a client who was serving time for the sexual assault of a small child more than 100 times. He also spoke of engaging in sexual acts with animals and expressed fantasies involving hyenas, pregnant women, and women giving birth. I am still traumatized by this. Story 35. I'm not a therapist, but I volunteered for a year for a suicide prevention line. I once had a white male client who was seeking help for his sadness regarding people of color and members of the LGBTQ+ community. He was a white supremacist who wasn't looking for help to change his beliefs. He was disturbed by the state of the world not fitting his racist worldview. He essentially expressed, "I'm upset because not everyone is straight and white." Story 36. A woman we will call Joe regularly complained about her relationship with her daughter. Her daughter had been taken from her when she was 8 years old because Joe was unable to parent properly. Joe's driving ambition in life was to regain custody of her daughter, but everyone, including her daughter, conspired to prevent that from happening. Turns out Joe's daughter is 21. You cannot obtain custody of a 21-year-old, but Joe's fixation is what has driven her daughter away. Imagine stalking your own child while trying to regain custody when they are an adult. Since her daughter is 21, I did not have to worry about any duty to warn statutes, which is fortunate, as that situation would have been quite complicated. Story 37. I have worked in acute psychiatry for the last 18 years and 25 years in the field. I have learned so much from so many people. The only real judgment I have of anyone these days is whether or not they are dangerous to be around. If they are, I have some strong opinions. Judgment is a peculiar thing. A person has to believe their perspective is the correct one to have. As far as I can tell, we are all just guessing at what it means to be a human being trying to live a meaningful and fulfilling existence, created, raised, and surrounded by other human beings. Story 38. I was the patient in this scenario, but at one point, after seeing my therapist for several months, she wanted to examine why being around my mother was so stressful for me. I recounted to her the story of telling my mom that her son had abused me throughout most of my childhood, and that I wouldn't be visiting for Christmas anymore because I could no longer sleep behind a locked door. My mother proceeded to scream at me and insult me while I sobbed so hard that I ended up vomiting. She then emptied all my bank accounts, claiming I no longer deserved to go to college. She eventually returned the money about a week later and called to tell me I had missed the very expensive present she had bought for me, which was a lie. She hadn't bought anything. She continues to pretend this never happened and tells everyone that I never talked to her. My therapist's response was, "What?" followed by a moment of silence as she processed that. Story 39. I had a client tell me they were afraid to move forward in their relationship because they thought their partner might become a secret vampire. They were worried that one day their partner would literally start sucking blood. It took everything in me not to burst out laughing. The things people come up with when feeling stressed can be quite surprising. I understand that anxiety can make your mind race. I helped them sort through it, and they ended up realizing they were just projecting fears from an old horror movie. Still, that was one of those, "Did I just hear that right?" moments for me. Story 40. Even though I am a therapist, I am still human and have my own reactions. How I handle them in therapy is important. I have worked with several individuals who have committed objectively terrible acts without any remorse. In those cases, it is my responsibility to be a bit more confrontational. Not necessarily judgmental, but attempting to push past their justifications or self-victimization so they may appreciate the harm they have caused. Story 41. I'm not a therapist, but I worked as a residential advisor at a mental health treatment center for about a year before moving on to a different area of healthcare. We had a sex addiction program, and many of the clients' past actions and behaviors were difficult to stomach. One man cheated on his wife with his best friend's teenage daughter, even though he had teenage children himself. Another frequently brought escorts into his home while his children were present. One man had inappropriate relationships with animals, and another had been caught with child pornography. It's not that I judged them, but many of these stories evoke a sense of existential dread. The darkness of the human condition runs deep. This could have happened to me or someone I know, and it can be difficult to cope with. Many of the clients were also extremely unpleasant to be around due to their personalities. They exhibited domineering traits, obsessive behaviors, poor boundaries, emotional instability, manipulation, anger, irritability, and compulsiveness. It takes a lot of understanding and compassion to support them through it all. Not always easy, but many had extremely traumatic pasts that made empathy easier to extend. Commonly, they had experienced horrific sexual abuse. In one case, a client was repeatedly assaulted by his brother throughout childhood while his parents were aware and did nothing. His mother even walked into the room during an assault and simply turned around and left. These are the types of challenges the clients faced. I believe that people who pursue careers in mental health are remarkable individuals, but I could not do it long term. It's a tragic reflection of our society that most professionals in this field are compensated poorly. Story 42. I don't want to violate anyone's confidentiality, and I'm concerned that clients could recognize themselves in some of these stories. Please be cautious. Most of the time, when someone tells me they had a good childhood without real issues but experiences significant anxiety, depression, obsessive-compulsive disorder, or eating disorder behaviors, I prepare myself to hear very troubling accounts and am rarely disappointed. The worst stories I've encountered were prefaced by those words. Story 43. I have seen and heard a lot as a therapist. However, my significant moments never come from what my clients say or do. They come from what their families say or do. I have had 2 clients who were victims of factitious disorder imposed on another, better known as Munchausen syndrome by proxy. Those mothers surprised me repeatedly. The lengths they would go to keep their child sick and to try to convince medical professionals that their child was unwell were extreme. The most surprising part is they fully believed the delusion despite numerous professionals stating their child was not sick. Story 44. A mother in family therapy with her 2 sons expressed that she had paid for a prostitute for her 16-year-old and would do the same for her youngest when he got older because she wanted them to learn how to engage properly. Story 45. Mom admitted she didn't love her adult children. The following week, she wondered why her children were struggling and seemed unlikable. Story 46. Animal abuse. Not a therapist, but a nurse at a mental health facility. For a time, we were taking patients as young as 6. We had one girl who was 7. She came from a very neglectful, probably abusive situation. She was adopted by a nice family at age 3, and she was absolutely adorable. Her parents brought her in because they discovered she had been harming neighbors' pets. She brought home a kitten she had killed, poked its eyes out, and stuffed candy in the empty sockets. After several psychiatrists consulted on the case, the consensus was that she should be placed in an institution for life. It was heartbreaking on so many levels. I have no idea what happened after because we were not a long-term facility. Story 47. I was shucking corn and I asked my grandmother why she had 14 children. She looked at me as if I were an alien and said, "What makes you think I wanted any children? That's the only option available to girls." Story 48. This is quite disturbing, so please don't read on if you are easily triggered. I have a client in their 80s who was placed in an industrial school run by Christian brothers. One of his core childhood memories is a stray dog coming onto the grounds that the boys looked after for a week, sneaking it the little food they had for the comfort of a dog's unrelenting love. When one of the sadistic brothers found out, he hung the dog in the courtyard in front of all the boys. He made the boys watch for an hour as he kept letting go of his makeshift noose. My client told me he will never forget the sound of all the boys crying as they were forced to watch this cruel act. This brother continued to smoke cigarette after cigarette, and the smell still triggers my client to this day. Organized religion has caused immense suffering. If this image has been burned into my brain from the description, I can't even fathom how those boys felt living through that kind of horror. Story 49. I prompted such a reaction when I listed the medications my narcissistic stepmother had me take. At one point, I was prescribed 4 Ritalin, 2 Wellbutrin, 1 Adderall, and for a month, I was also on Depakote. Story 50. I once shadowed an appointment where a man was consistently late to practice by at least an hour. When asked about his punctuality, he explained that he always took the longest route because it was the only route where he believed there were no cameras following him. We still do not know who he was referring to, but the delusion of persecution is concerning. Story 51. I am an addictions therapist, so I have seen people from all walks of life in various conditions. This experience makes it difficult for me to judge anyone for their struggles. However, I do find myself judging when professionals, such as doctors or lawyers or wealthy individuals, act as if their addiction is less damaging due to their income, profession, or social status. Their harmful behavior does not deserve a pass. Respectfully, no. Story 52. My ex was a therapist, and she told me about a patient who kept sleeping with a man who would tell her to leave the next morning. She was in love with him, but he was openly just using her for sex, even telling her that to her face. This situation lasted for over a year. The patient refused to confront him, and despite claiming she would never speak to him again, she would go out of her way to bump into him and sleep with him about 2 to 3 times a month. My ex said she did some research to see if she could obtain a restraining order between them. Story 53. I am not a therapist, but I schedule first-time therapy appointments. A few years ago, a parent of a 4-year-old child told me they wanted to go directly to medication and bypass therapy because they did not have the time. They also inquired if we would use charitable funds to pay for services at the child's school. Typically, I would not judge a parent for this, but seeing as the other parent's name and face were plastered everywhere around town while they were running for an unpaid political position and living in a $1 million home, I went ahead and judged them harshly. I am sure you can guess the party affiliation, the one that promotes family values. Story 54. I worked with individuals with developmental disabilities. I supervised a visit between my client and her brother, who had exploited her. Since she wanted to see him and there were no charges, we focused on keeping her safe. Someone I was coaching shared that she had caught her daughter being promiscuous once and punished her. Since it was an old story and the child was now an adult, I was advised not to report it. Story 55. I am not a therapist, but I am a school counselor. Early in my career, I briefly worked at a very rural elementary school. I encountered a high number of students who were struggling with suicidal thoughts during my short time there. Almost all the parents had explosive reactions upon hearing this about their child and expressed anger towards them. They also did not believe in mental health services and were upset that the school recommended counseling. It was a challenging situation. Story 56. I had a client report she was happier than ever in her new relationship. She had a stable partner who helped provide for her son. The best thing was there were no awkward introductions because her son already knew him. He is her half-brother. Story 57. To add as a patient, not a therapist. At 16, I was going through a really terrible time and, to cut a long story short, I was thrown into emergency therapy to ensure I wouldn't harm myself again. After sharing my story with the therapist, he said something that fundamentally changed me. He asked if I thought my struggles with my social life and school were linked to the problems I was facing at home. He pointed out that the abuse and mental toll I experienced at home were the reasons I was failing in my personal and academic life. It was the first time I felt truly validated. Story 58. A friend of mine has an in-house therapist at their job because they primarily work on residential school claims. The therapist at their office was on site for the aftermath of Jonestown and helped with the recovery efforts. That must have been quite a shocking experience. Story 59. I'm a client who watched my therapist have a moment of surprise. I casually mentioned that I had skin cancer when I was 16, which was removed without chemotherapy, and I was fine. She was astonished that I didn't feel traumatized by that. So I told her, well, my boyfriend at the time was abusing me, so it didn't seem like a big deal. I felt so bad. Story 60. For me, it was more of a series of moments. I can't help but feel some kind of way when a parent brings me their teenager who is suicidal or depressed and clearly does not care, while the child knows they don't care. I can understand that something may have happened to the parent for them to act that way, but I struggle when parents bring their teens to me with the intention of fixing the kid, rather than providing support and guidance for the family. It crushes my soul when I see a teen who is so used to being cast aside that they don't react when the parent throws a fit because the teen needs to be assessed for safety, and it is an inconvenience to the parent. It is really difficult to withhold judgment in those situations. Another shocking moment was when one of my clients openly admitted to being racist, homophobic, transphobic, and sexist, and he felt good about claiming those labels. That was only one of the reasons I had to transfer him, but it sent a chill down my spine when he looked me in the eye, knowing I am a queer therapist, and proceeded to tell me all the ways in which he hated my community. So yes, there have definitely been some interesting moments. Story 61. I have worked with suicidal children, and I have had parents ask me to push unreasonable requests such as make them lose weight, convince them they are straight, and make them study more. These parents make their child feel inadequate for being who they are and then wonder why their child attempted to take their own life without any self-awareness. Story 62. Not a therapist, but I used to be a support worker for survivors of abuse, both adults and children. I've had a couple of experiences that deeply affected me. The sheer number of women who don't realize that someone having sex with them while they're asleep is rape. One woman was raped so severely and so often by her ex that she suffered a vaginal prolapse and blocked passage, which required surgery, and he continued to abuse her during her recovery. Another woman didn't know that she didn't need her husband's permission to go out with her friends. And for the children, the 14-year-old boy who had been physically and psychologically abused by his sister's father when he was 5 years old. His twin brother and sister were not abused, only him, to the point that the abuser held this child face down in the bathtub. My heart shattered for this boy, the 9-year-old boy who shared with me about his demon side, which tells him nasty things, making him feel useless and pointless. He has had thoughts of self-harm and suicide at just 9 years old, and he doesn't feel he can tell anyone because boys don't cry, and crying makes you weak. The 13-year-old girl whose father bought and forced her to wear sexy lingerie when she was 9 years old, while he masturbated and didn't even stop when his 8-year-old son entered the room. The mother ran away with the children after that, and she had to learn English. Her husband had never allowed her to learn despite having lived in the country for years. One of the first words she had to learn was masturbated. Just gross. I never judged my clients. I loved working with those people. But their abusers? They don't spend nearly enough time on fire. Story 63. I was a therapist for a brief period and then moved on to another profession, but I will never forget one client in particular during my internship. My internship was at a site that primarily conducted court-mandated therapy sessions for individuals involved in the criminal justice system. This client was in the system because he had molested his girlfriend's 12-year-old daughter while the mother was asleep in the bed. As a therapist, we were taught during our training that all human beings are fundamentally good, and I believe that with very few exceptions. However, this man was an exception. He felt no remorse or guilt for his actions and, worse, he attempted to justify them. It was clear in our conversations that this wasn't the first time something like this had happened, not just with this child, but with others. Sitting with him for an hour at a time was difficult, and he stopped attending after only a few sessions. The email I sent to his parole officer, stating that he had missed his court-mandated sessions, was the only one I was glad to send during my time there. I am sure this man had a terrible childhood himself, and perhaps over several years he could reach a better place, but in my view, the only place for him was in a jail cell for the time being. Story 64. When someone said, "I know you're trying to help, but I can only reach orgasm if I imagine you," it led to marital counseling. I obviously didn't help, despite feeling completely unattractive compared to his beautiful wife. I think he just attached to me as I listened, but that's part of the job. She was outraged and called me an ugly person. It goes with the job. Story 65. Not just one moment, but during my internship, I co-led a group for sex offenders. The rationale I heard from many of them about why they committed their offenses affected me deeply. I ended up getting pregnant halfway through that year, and I had to work through a lot of negative feelings to continue showing up and doing my job. Story 66. It wasn't necessarily that it was bad, but it completely caught me off guard. I was in a role where I worked with groups of people together, and I also saw them individually. They all knew each other through the program they were part of. After working with them for almost a year and approaching my final sessions, one of them told me that their married coworker, who was also my client, had confessed they were in love with them, wanted to leave their spouse, and requested a joint session with me. My eyes went wide because it was so unexpected. The married client had never given me any indication of those feelings, and I knew I would be terminating with both of them shortly. I didn't conduct the joint session. I learned then to maintain a much better poker face. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.